So, hello everyone, am I audible? Hello students, am I audible so that we can start the session? Started. Okay, so this is the first session which we are going to start. So this is the first day lecture topic which I am going to cover up. So before starting the session, okay students, those who are live, they can just, okay, good evening. So I am audible everyone, everyone? Okay, so I am audible. So actually, if I talk about the course which has been planned is to crack the examination for your NEET MDS and INICT exam. So I have included, I am covering the topic along with the past year MCQs. So I have just gone through all the 10 years MCQs which has been asked in your examination, and for that any topic which is covered, relevant MCQs will be also discussed. So like today is the first day, so I'm starting with cartilage, joint, skull, cranial, foramina, triangles of the neck. So these are these are very important topics. So actually for this entire session, the most important topics which definitely year by year, definitely question is asked from that topic will be covered in this session. Okay. So starting with the very first topic, I would like to start with joints. So what I have seen in the INICT and the NEET MDS examination, that joints has been asked and you have to know the types of joints. So it is not that just they will ask you about the joints of head and neck region, but in general, all the joints of the body will be asked. So it is important that you should be well versed with the joints in our body. So, and any of the students, if they are not understanding anything, yes, good evening, my dear students, good evening. So, we will connect it for the entire session of anatomy. So, let's start with the best of luck so that you can cover the entire topics and also you can solve all the MCQs relevant from these topics. So, basically, 80 to 90% of questions are coming from these topics only. So, our target is to cover the most important topic. It's not many of the students, we are connected in the Telegram group, and also the coordinators have told me that students at times tell that ma'am, notes has got a bundle of things, so many things, and the live session has got not all the things. So the target is to achieve or crack the examination. Our target is that. It's not that we are worried about one or two topics, which definitely in each examination no one is knowing, no one can tell that which topic will be asked, but definitely the topics which is targeted in this session, definitely the questions are coming from that topic as per the last 5-7 years questions. Okay. Yeah, hello Pandey, hello everyone. So if I talk about the classification of joint, it can be categorized as the three. Okay, I also feel that many of the DBMCI student has already been prior provided with the soft copy. So I request everyone to write the notes in this prior provided soft copy. Okay, so at the end of the session, you will have the notes prepared and you can just go through this before your examination. So many important images and all the images relevant and tables has been added. Okay, so if I categorize the joint, it is of following three types: fibrous, cartilaginous, and synovial. Okay, when I'm using the word fibrous, it means the joint is not mobile. Actually they have got fibrous articulation. So generally what happens, skull sutures has got sutural ligament connecting and no movement occurs in this joint. And we have got further subcategory of these basic joints. In case of cartilaginous joints, there is a hyaline cartilage and there is also part of fibrocartilage which is connecting it, and we have got two types of cartilaginous joints. So cartilaginous joints are very slightly mobile, and synovial joint, which is having a synovial membrane in the joint cavity which will secrete synovial fluid, which is very important for the lubrication. Means the joint is easily mobile because of the presence of this synovial fluid. So they are multi-axial. Yes, Anurag. Okay, they are multi-axial joint. So Anurag, yes, me, yeah, sure, we can be little slow. So Mohammed Junaid, page number. No, but it's just started. So I have already given you the notes. No, I have already given you the soft copy. Okay. Okay. So I want you to go through this session according to my notes. Okay. Everyone, please don't tally your work, your notes and this topic. So you go through this because it is relevant to your examination purpose. So you have the soft copy. You will have the soft copy prior. For example, today is the first class. Okay. So today is the first class and I have already given you the soft copy. So what you can do in the soft copy, you can write the notes. Okay. So it's very important that in the soft copy, you will write the notes. And I think many of the student is already having it. Okay. So the classification of joint, if I'm talking about the structural classification, it is of fibrous, cartilaginous and synovial. Three varieties are there. Okay. Now, if I talk about the functional classification, so what do you mean by the function? Means what it performs. So in that category, we have got how many types of joint? We have got three types of joint: synarthrosis, amphiarthrosis and diarthrosis. So it's very important for you to understand the meaning of these functional classification and the meaning of. Yes, Bora, good evening. Let's have a great session. Yes, why not? Sure, Bora. So I want you to understand all these topics with the relevant images which I have shared with you prior in the soft copy. So when I'm using the word synarthrosis, what does it mean? It means that category of joint which is not mobile. So synarthrosis joints are synarthrosis joints are not mobile, or you can say not mobile or movable. Okay. So for example, I was telling about the fibrous joint, which will be categorized as, which can be categorized as the synarthrosis. Okay. Amphiarthrosis. When I am talking about amphiarthrosis, these are those type of joint which is slightly mobile. Okay, which is slightly mobile. Okay, so these joints are slightly mobile. And when I am talking about diarthrosis, so diarthrosis joints are highly mobile. These are highly mobile joints. So that means on the functional aspect or on the functional basis, we can divide the joint into three categories. One category of joint is not mobile, no movement occurs in this joint. The other category, which is amphi, that means it is slightly mobile. And the third category is diarthrosis, which is highly mobile. Okay. Tabassum, don't worry. Actually, if you haven't got the soft copy, then you can get the soft copy after the class. If you haven't got prior, because many of the students has already shared by the DBMCI group was the prior soft copy, so that students can write there. Okay. So if any student is not having it, don't worry. You understand the concept and you will get it after the class. Okay. Is it okay, dear? Okay. Now please concentrate on the class. So again, I would like to slightly elaborate it. So when I am elaborating it, you can see the classification of joint. So I have already explained the structural and the functional classification. The first category of joint is structural. When I am using the word structural, what does it mean? Lakshita, Bora, Jahan, Anurag, Mohammed, Sheikh, everyone. Structural means the structural formation. According to that, the classification of joints. Okay. So that means fibrous joint are one category of joint with where no movement takes place. Okay. So what does that mean? Fibrous joint will be in the category of synarthrosis. Cartilaginous joint where slight movement occurs. So that means cartilaginous joint is in the category of amphiarthrosis. And the third category is synovial joint, which is highly mobile joint, and it is in the category of diarthrosis. So everyone, have you understood? Can I once again I will explain you. We have got two types of classification. One is structural and the other is functional. Now I am connecting the both joints. So when I am using the word fibrous joint, that means it will be in the category of synarthrosis, no movement occurring in this joint. Okay. Cartilaginous joint, very slight movement. So it is in the category of amphiarthrosis, and highly mobile joints are synovial joint, which will be in the category of diarthrosis. Everyone, Lee, Saima, And Anurag, Shaq, Mohammed, Pandey, have you understood? Can I move? Can I move to the next slide? So please give me a thumbs up whenever I ask you that you have understood or not, so that we will have a proper interaction and I can understand that my students are understanding or not. Okay, so Lee is telling okay. Understood? So actually, after solving this topic, I will also go through the MCQs which has been asked in the previous year of examination. Very good. So everyone has understood. Now, what I have seen that many times these question has been asked about the examples, So let's go. Okay, Shruti is telling repeat, ma'am. Okay. So the word sinath, Shruti, it is for you. It is for you. Uh, which topic is, ma'am? Please go on to the next slide. So various students are giving, okay, this is the first topic, that is joint. So synarthrosis means that joint, that is fibrous joint, which is not mobile. Cartilaginous joint is functionally amphiarthrosis, which is slightly mobile, and synovial joints are diarthrosis, which is highly mobile. Now, our next important point is to know the example of each variety. So, please have a look on this image. We will talk about the fibrous joint. So, in this fibrous joint, we can have the sutures, syndesmosis, and gomphosis. So, in the fibrous category, we can have the three subtypes: sutures, syndesmosis, and gomphosis. Okay, sutures, syndesmosis, and gomphosis. So when I am talking about sutures, they are present in the skull bone. So they are present in the skull bone and they are connected by sutural ligament. There is no movement. The other category is syndesmosis. So when I'm talking about syndesmosis, they are interconnected by intraosseous membrane, and one of the best example of syndesmosis is articulation between radius and ulna in the middle part. So actually, when you see the inferior articulation between tibia and fibula, my dear students, tibia and fibula are the bones of lower lip. Okay, radius and ulna is the bone of upper lip. So the connection in the middle part of radius and ulna, which is termed as middle radio-ulnar joint, is an example of syndesmosis. Okay. Okay, Shweta. And if I am talking about articulation between lower end of tibia and fibula, the lower end of tibia and fibula has got an articulation via interosseous membrane, and it again becomes an example of syndesmosis. Okay. So Anurag, when I am talking about syndesmosis, the articulation is via interosseous membrane. Don't worry, I will write it also. Everyone. Yes, syndesmosis is a PY question. Very good. Who is this? Pandey. Yes, Jayesh Pandey, you're absolutely right. So when I am telling you about the syndesmosis, here the articulation is via interosseous membrane. Okay, the articulation is via interosseous membrane. Okay, this is syndesmosis, and the middle part of radius and ulna and the lower part of tibia and fibula is connected via interosseous membrane, and these are example of syndesmosis. Gomphosis, I think most of the students are knowing the answer. Gomphosis is the peg and socket, so it is the tooth socket joint where the connecting structure is. What is the connecting structure? Periodontal ligament. Okay, now I will show you many images to understand this. So once more, sutures, I'm going to show you many images, don't worry. Sutures examples are all the sutures which is present in the skull. Okay, so sutures means where it will be present in the skull. Syndesmosis, what do you mean by syndesmosis? The articulation is via which structure? Everyone give me the answer. It is via interosseous membrane. A ligament is there which is connecting it, and there is the example which is middle radio-ulnar joint and inferior tibiofibular joint. I will write it also, don't worry. Okay. Gomphosis means they will have the tooth and socket joint where there is periodontal ligament. Okay. Now, let's see this images. Now, suture type. So, can you see this images? So, you can see frontonasal suture. Frontonasal suture. Where is the frontal bone? This is the frontal bone, and here will be the nasal bone. Frontal bone and nasal bone. So, articulation between the frontal part of the skull and that of the nasal part of the skull becomes an example of plain sutures. Okay. Actually, syndesmosis is very good. Introosseous membrane, introosseous ligament, Lakshita, Anurag. A thumbs up goes for you. Very good, Lakshita and Anurag. Okay. So now I'm showing you few examples of the sutures. So frontal bone and the nasal bone is articulating, which is called as frontonasal suture. Yes, it is. Yes, Dr. Tiwari, it is the connected by dense connective tissues. Yes, and sutural ligament. Sutural ligament. Okay. So if you want to write, you can write this also. Suture, there is connecting structure that is called as sutural ligament. Sutural ligament. Syndesmosis, there is interconnection via introosseous membrane. And for gomphosis, there is periodontal ligament. Okay. So you will write fibrous joint is having three sub-classification. The sutures, which is having the sutural ligament. Syndesmosis, which is having the interconnection by introosseous membrane. Gomphosis is periodontal ligament. Periodontal ligament. Yes, Saurabh, it is from page number 1. So this PDF notes will be shared to you after the class finish, and also few of the student is having the prior soft copy and the PDF notes, and you can write in that PDF notes. Okay. So is it okay? So we will have the most important topic covered for your examination. Okay. So according to my notes, which I will give you after every session, it is the first topic of my class. Okay. So you just understand. Don't worry, you will get the PDF. And maybe the team will share the soft copy of the PDF notes once more who have not received. But I think study I have already shared in the group. So if you haven't not got, so don't worry. We have to cover the course also. Just concentrate on the topic. Get your concepts cleared. Once it is finished, I will share the PDF. Written, my dear students, can we move? Okay. Now, sutures. So there are sutures means articulation. So in the skull, we have got, okay. So in the skull, we have got frontonasal suture. So in the skull, we have got frontonasal suture. Okay. They have shared. Very good. Now for cracking the exam, you have to go through my notes. If anybody has got more time, so they can go with the entire previous notes also. Is it okay? Is it okay? So for cracking the exam, you have to go with my notes, and those who want to study, they have got more time, so they can go with the previous notes also. Now, serrate suture is the suture between the parietal bone. If I am talking about serrate suture, it is in the sagittal suture, which is connection between the parietal bones. Squamous suture is between the temporal and parietal. Denticulate suture is lambdoid, and Schindylesis is between the rostrum of sphenoid and ala of Bowman. Okay, so all examples are here. Don't worry, no need to write. I will show you the images for you. I want to show you the images. So, for example, see here. Okay, so this is a table where all the examples are there. Just for better understanding, let's go on to the images. So let's talk about plain suture. So the example, so here the example of plain suture is, can you see here the palatine process? So this is the plain suture. So I am just highlighting it. So this is the plain suture. So the articulation, okay, the articulation which is happening between the palatine process of maxilla becomes an example of plain suture. Okay. So different bones of the skull will articulate with different shapes of the suture. So if it is just plain, if two bones are just closing each other like a plain suture, then it is called as plain suture. An example is palatine process of maxilla. Yes, you are right, Anurag. I will show you. Okay. Yes, sure, I will send you the annotated video. I request everyone, so please understand the concept first. Everyone is worried about what we will get. We will get the PDF notes or not. Don't worry, everything you will get. You just firstly understand the concepts. Okay. Got it now. So yes, I got many students were telling me, ma'am, serrate suture is the sagittal suture. Now, for your better understanding, I have included this image where you can understand the articulation. So here, my dear students, can you see the red color articulation which is taking between the two parietal bones? So what is this? These are the two parietal bones. So these are the two parietal bones. So this is one. No, same lead, that is same lead, that is same. This is also parietal bone. So the two sides parietal bone articulate. The two sides parietal bone articulate, and that articulation is in this in zigzag manner and serrate like. Okay, you must have seen the uh, axe. Okay, when we cut the wood with an axe, so that is in the shape of serrate. So serrate means like this. The sutures are like this. So these are serrate suture. So what is the example of serrate suture? The example is sagittal suture. The example is sagittal suture. The example is sagittal suture. Okay. Serrate example is sagittal suture. Yes, jigsaw fashion. Yes, you can say jigsaw. Very good. Who is this? Abdul. Yes, you are right. Jigsaw fashion. These are common words just to make you understand. Okay. Yes, frontonasal is already there. No, frontonasal is also an example of plain suture. Yes, frontonasal is also an example of plain suture. If you want, you can write that also. That is already written. So I'm saving the time, my dear students. Okay. Just to make you understand, I have included multiple images. So yes, plain suture example is palatine process of maxilla, frontonasal suture. These are example of plain suture, frontonasal suture and palatine process of maxilla. Okay. Serrate suture is the sagittal suture. Articulation is in the form of jigsaw fashion. Now coming to squamous suture. So can you name, so see here, which bone is this? This is the parietal bone. And this is the squamous part of temporal bone. This bone is squamous part of temporal bone. So this is exactly, so when I'm talking about, I just want to highlight this suture. So this articulation which is taking place between the parietal and the squamous part of temporal bone is called as squamous suture. So parieto temporal, the name will be parieto temporal suture. Yes, the name will be parieto-temporal suture. I also want everybody to focus on the most important part. So I think suture is very easy, and I don't think that exactly in suture there are 2 points which will be asked more. I will point that. Don't worry. I just want to explain different articulations, so I am showing you these images. So you can see the shape of squamous. So that means you can see the shape of squamous. It is in this shape, and so it is called as squamous. Why? Because mainly the squamous part of temporal bone is articulating with the parietal bone. Yes, parieto-temporal suture. The next is denticulate. So denticulate means the articulation is in the form of teeth. So the articulation is in the form of teeth, and the best example is lambdoid suture. So let me show the enlarged view. So see here, when I am enlarging this, if you closely see the sutures, they are in the form, the articulation is in the form of teeth, like teeth. Okay, dentine. So it is called as. So that means lambdoid suture is an example of denticulate suture. Yes, Anurag, a thumbs up goes for you. Very good, dear. So denticulate suture is an example of lambdoid suture. Yeah, function means it is if the it is joining the skull, no Pandey, it is joining the skull bone. So in actually when I'm talking about skull bone and face, I will show you also they have got different bones. They have got parietal, frontal, occipital, different bones are there. So these are joined or in connected. So basically what happens at when the baby is born and the sutures have not fused, so there is space and that helps in the expansion of brain. So they are accommodating the part of central nervous system brain, and after some time the different sutures fuses. So that topic will also come. I will also explain that when the important sutures fusions I will explain. So it is accommodating and giving protection to the structures lying inside. Okay, so they are very strong. Strength is very much okay, Pandey. The strength of these kind of connection is very strong. Yes, fontanelle. Very good, Mittal. Yes, fontanelle. I will explain that. Now, this is very important for examination. So, this has been asked. So, MCQ. Why I have written MCQ? Because this has been asked in the previous year of examination. So, we know that there are two bones. Okay. So, when you see the basal, when you see the inferior aspect of the skull, so it is one. Can you see? I have encircled. I have make a round. Okay. How we are seeing the skull? We are seeing the skull from inferior part. Inferior part means from below. We are seeing the skull from below. So when I am seeing the skull from below, what you can see, the articulation is here. This articulation. So this articulation is an example of Schindylesis, and these has been asked number of times in the NEET PG MDS exam, INICT exam. So Schindylesis example will be articulation between rostrum of sphenoid, articulation between rostrum of sphenoid and ala of Vomer. Very good. Yes, you can see here in this diagram, you can see this is the rostrum, means this is the protruded part. This is beak like protrusion which is articulating with the groove, that is ala of Vomer. So this is wedge and groove. This is wedge. It feels like some structure is going inside a groove. So it is wedge and groove. And the best example of Schindylesis is the articulation between rostrum of sphenoid and ala of Vomer. Yes, Saurav, you're absolutely right. When we see the inferior aspect of the skull, that is called as the normal basalis part. Yes, you are absolutely right. That is called as normal basalis part. So done? Done, dear? So when you see the articulation which is happening between the rostrum of sphenoid, so when we are talking about the articulation which is happening between the rostrum of sphenoid and that of ala of Vomer. So what you can see, the wedge, it is an articulation which can be explained in the form of wedge and groove. So something is articulating from above. So wedge is the rostrum part of the sphenoid bone which is going inside a groove. So the groove is formed from which bone? Vomer bone. And this articulation is an example of Schindylesis. Schindylesis. Okay, Divya? Everyone, I have explained once more. That is an articulation between two bones where it appears like one structure is growing inside the groove. That is the rostrum of sphenoid is going inside the groove. That is ala of Vomer. Okay. Yes. Please write on. I am slow only. Don't worry. I am slow. Okay. Got it? Okay. Now coming to the next variety. So syndesmosis, this is again very important for previous year MCQ. So if I am talking about syndesmosis, again it's a very important topic. So I already told you, for example, you can know this is the radius bone, that is the lateral. So when you see the fora, In the forearm, we have got a lateral bone and we have got a medial bone. The lateral bone of the forearm is radius, and what is the medial bone? The medial bone is ulna. So in the forearm, we have got a lateral bone called as radius, and we have got a medial bone called as ulna. So these two bones are articulated with each other. They are connected to each other by an intervening structure. So I'm using green color to show you the interosseous membrane. So can you see? Anurag, yes, I see here. This is the articulation. See the image. Okay. So just see this image. This is the articulation. Okay. Rostrum is sphenoid and ala of woman. Okay. Okay, Anurag. Now, see this. So articulation between radius and ulna is done via interosseous membrane. So it is connected via interosseous membrane. In the middle part, as you can see, this connection is only seen in the middle part. Okay. So what is this joint? So syndesmosis example will be, middle radio ulnar joint. Middle radio ulnar joint. Other examples is inferior tibiofibular joint. So what do you mean by tibiofibular? That means articulation between the leg bones. Okay. So tibia is the medial leg bone and fibula is the lateral bone. So we have got two bones in the legs. So in that leg we have got tibia as the medial and fibula as the lateral. So articulation in the lower part of tibia and fibula is inferior tibiofibular joint. So these two examples are again the example of syndesmosis. Middle radioulnar joint, inferior tibiofibular joint. And the third one is in between spines of vertebra. In between spines of vertebra. So these are all examples. Okay. No, what I have written, that is middle radioulnar joint, inferior tibiofibular joint, and between the spines of vertebra. So this is the best example. Okay, these are the best example of syndesmosis. Okay, yes, connecting link is the interosseous connection in the inferior part of tibia and fibula. So middle radioulnar joint, inferior tibiofibular joint, and between the spines of the vertebra. Now going with this. So I also want you to show that here we have got inferior interosseous ligament which is connecting here. This bone is tibia and this bone is fibula. So this is again example of syndesmosis. No need to write once more. You have already written. So you have already written, so no need to write once more. Okay, dear students. Now, gomphosis. You already know gomphosis. The connecting link is via periodontal ligament. It is also called as peg and socket joint. So gomphosis example will be tooth socket. Where it is present? It is present in tooth socket. It is present in tooth socket. I think everybody is knowing this. Okay. No, calcaneonavicular is a separate joint. Anurag, I will come. No, that is not syndesmosis. Calcaneonavicular. Talus, calcaneum and navicular. The three bones articulates, then it becomes the Ball and socket joint. Okay, Anurag, I will come at the ball and socket joint, then I will tell you. So talocalcaneo-navicular articulation. Actually, that articulation also takes place along with the navicular bone. That becomes an example of ball and socket. So I want everybody to write the example of each variety of joint. So many examples I will give. So everyone please note down, because these are going to be asked in examination. Okay, done. Now we have finished this. The next category of joint is cartilaginous joint. What is it? Cartilaginous joint. So there are two types of connection. So here we can see this is the, if two bones are articulating by a hyaline cartilage intervening in between. So you can see two bones are articulating, and the two bones, the connecting link is hyaline cartilage. What is the connecting link? Hyaline cartilage. But in the case of second variety, you can see hyaline cartilage is interconnected, and this hyaline cartilage is also having in between fibrocartilage. What is it? Fibrocartilage. So such joint is, so we have got two types of joint. The first category is called as primary cartilaginous joint, and the other name of primary cartilaginous joint is, it is called as Syndesmosis. And if I talk about the second category, which is having the connecting, so two bones are connected via hyaline cartilage, and in between the hyaline cartilage you can see there is a strip of fibrocartilage. So this is called as secondary cartilaginous joint. And secondary cartilaginous joint is also given another name, which is called as symphysis. It is called as symphysis. Is it okay, everyone? So we have got the, so cartilaginous joint becomes an example of amphiarthrosis, slight mobility is there. So in this category also we have got two types. One is the primary cartilaginous joint, and the other is secondary cartilaginous joint. It's also important for you to know the name. So secondary is also called as symphysis, and primary cartilaginous joint is also called as synchondrosis. Now, what is important for you is to know the example of these joints. So, it's very important that you should be aware of the examples of these joints. So, let's come up with the examples. Now, if I talk about the examples of synchondrosis, which is actually the connection is via hyaline cartilage. So, we will have its presence at the epiphyseal plate. So, where it is present? Epiphyseal plate. Now, for example, everybody understand, if I take an example of this pen as a long bone. So, long bone will have a middle part which is called as shaft, which is diaphysis, and the long bone will have ends which is called as epiphysis. So the junction of epiphysis and diaphysis, where the middle part and the ends of the bone joins, that junction is having epiphyseal plate, which is an example of which is containing hyaline cartilage, and this becomes an example of primary cartilaginous joint. Other examples are also there for primary cartilaginous joint. So we will have the sternochondral joint. Okay, so it's very important that you should be knowing examples of primary cartilaginous joint. So yes, dear. So primary cartilaginous joint means articulation between the joint. If I talk about primary cartilaginous joint, the articulation between the joints is via the presence of hyaline cartilage. So a best example of this is the epiphyseal plate or epiphyseal plate, which is lying at the ends of the bone. Okay. Now, so in other words, you can also say growth plate of long bone, growth plate of the long bone. And the other example is first rib articulating with the sternum. And also the synchondrosis is also seen at the base of the skull. So I just want you to write the list. So for your examination, it is very important that you should be aware of all the examples in our body. So best example is the articulation between epiphysis and diaphysis, which becomes an example of primary cartilaginous joint. So all of you please write down. I will write it and then again I will ask whether you understood or not. It is not very difficult. It's a very easy topic. Epiphyseal plate, which is called as growth plates. Okay. Then we have got first sternocostal joint. Then we have got the example of synchondrosis in the base of the skull is also there, that is called as spheno-occipital joint. Costochondral joint. Okay. So actually, if I talk about these joints, so they articulate, they are after some time they ossify, and the yes, Anurag, they will ossify. After some time, they will ossify and they will form, yes, Anurag, they will form synostosis. Okay. So that is like epiphyseal plate will form epiphyseal line. But the places where this articulation takes place is epiphyseal plate of long bone. That is also called as growth plate. That means it is located at the junction of epiphysis and diaphysis. Okay. Xiphisternal joint will be atypical. Okay, that will be not they. That is atypical. Okay, that is atypical, dear Anurag, because that is a midline joint, so it is also categorized as symphysis, but it is atypical kind of symphysis. Okay, so epiphyseal plate is the growth plate, junction of epiphysis and diaphysis. First sternocostal joint is there, spheno-occipital joint is there, costochondral joint is there. What is that? Costochondral joint is there. Okay. So if you want to write xiphisternal, you have to write the word atypical because it is also located in the midline. So actually it is structurally synchondrosis. So if I talk about xiphisternal joint, so in this category you can say it is synchondrosis structurally. So I will tell you why. Functionally, it is categorized as slight movable. But if I talk about synchondrosis, they are not movable. They are connected by a hyaline cartilage also. But structurally, it is xiphisternal joint is in the category of primary cartilaginous joint. Okay. So these are the best examples which you have to note down. Okay. Done, Anurag. Very good. Now coming to the midline joint in our body. So actually the next category is the secondary cartilaginous joint. My dear students, what is the name used for secondary cartilaginous joint? Symphysis. And the most important, these joints will lie in the midline. Okay, these joints are lying in the midline. So you can see here, when I am using the word symphysis, you can see there is hyaline cartilage. So basically what happens whenever two bones articulate, there is hyaline cartilage. But in that hyaline cartilage, there is a slip of fibrocartilage intervening. That means in between the hyaline cartilage, there is also fibrocartilage. Such kind of joint is called as symphysis, that is secondary cartilaginous joint. Very good. So please write down the examples of secondary cartilaginous joint symphysis. Yes. So all midline joints. So what is the symphysis example? that is all the midline joint. Symphysis example will be midline joint. Pubic symphysis. Then we have got manubriosternal joint. Okay, manubriosternal joint, intervertebral disc. Also, we have got sacrococcygeal joint. So basically, if I'm talking about these joints are located in the midline, and there is slight mobility, and actually the hyaline cartilage of the two bones are interconnected by a slip of or a strip of fibrocartilage. Okay. 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 If you have completed, then I will move to the next slide, because few of the students are telling me go slow. Okay. Okay. No, joint of Lusca is mobile. It is more mobile. It is not exactly located in the symphysis category. That is more mobile joint. Okay, Anurag. That is having more mobility. So it is not, will be not written in the symphysis type. Okay, everyone. So let's move on to the next. That is synovial joint and features. Okay, dear. So when I'm talking about synovial joint, they are multi-axial joint. So they moves in. So basically, synovial joint can be uniaxial, biaxial, multi-axial, plane type of joint. So the most important feature of, can anybody tell me, ma'am, your speed is fine. Okay, student is telling my speed is fine. Is it okay? Now I have slowed down. Is it okay? Now, because we will cover the topic also. It's also important that we have to cover the topic. So, synovial joint is having synovial membrane, which is secreting synovial fluid, which is important for the lubrication of the joint. So everybody must, yes, okay, everybody must have have bicycle, and you know, in the bicycle also you put oil. Why? Because you want to lubricate, you do the oiling part so that the movement becomes smooth. Same goes with the synovial joint. There is synovial membrane secreting synovial fluid, and when the synovial fluid is degenerated, the disease condition happens as the osteoarthritic condition. So we have to know the examples of synovial joint. So this is the synovial membrane which is giving its lubrication. So actually there are various examples. So again, this is a table, but I will write individual examples. So gliding joints are those joints in which the bones just glide over one another. Not much movement is there. You can see the bones are just gliding over one another. Slight, very slight movability, and the bones are just gliding over one another. Another is uniaxial joint, that is a hinge joint, knee joint, ankle joint, where the movement occurs in one plane. When I am talking about so this is pivot joint, there will be having rotation. Ellipsoid joint, where the articulation is in the form of elliptical articulation, and at various location. For example, the articulation in the wrist joint is an best example of ellipsoid. If the articulation is concavo convex type, saddle type, it is called a saddle joint, and ball and socket. So okay, no need to write the examples here, because I am going you to give the detail of types of synovial joint, and I am going to show you a number of images. So let's start with the plane joint. So what? Let's start with the plane joint. So I am coming with the first, that is the plane joint. So my dear students, let's talk about the plane joint. So all examples you have to write. So my dear student, whichever joint example I am writing, you write. Plain joint means not much movements, just the bones are gliding over one another. The bones are gliding over one another. Yes, Dr. Ritik Tanwar, you're absolutely right. So all of you write the examples. So the examples are, so we are writing the examples. The examples of plain joints are acromioclavicular joint, acromioclavicular joint, intercarpal joint, intertarsal joint. Same way, the intermetatarsal in intermetacarpals on also the articulation between the vertebral arches. So that is, you can see here the two vertebrae arch are articulating. So you can see the vertebra arches are articulating. The arches are articulating. Vertebral arches are also articulating, and this kind of joint is also given a name that is called as zygapophyseal joint. Zygapophyseal joint. Now, also the articulation between the rib and the body of vertebra and the articulation between the rib and transverse process is example of plain joint. So that is called as costotransverse and costovertebral joint. Costotransverse joint and costovertebral joint. Very good. Tanvi, what's you are very right, dear. Costovertebral joint. Yes, dear, but I will write more examples. Okay. Yes, dear, it is in the table, but I will write more examples. Okay. Some examples are not in the table, so I will write that also. These are most important for your MCQs. So most important for your MCQs. So plain joint examples are acromio. If you can just add on in the table, if anything is more which I have written, you can add on in the table. Okay. Acromioclavicular, intercarpal, intertarsal, zygapophyseal joint, costotransverse and costovertebral joint. Done? Yes, superior tibiofibular joint also. Yes, superior tibiofibular joint also. Yes, dear, you're right. Superior tibiofibular. So in our body, so many. So yes, superior tibiofibular articulation also. Okay. Done, everyone? Have you written this? Okay. Yes, except the first. Yes, dear. So it is costotransverse and costovertebral. I am talking about costotransverse and costovertebral joint. Lakshita done. Gloria done. Okay, dear. Now, hinge joint. So, no, it's actually not exactly. Okay, dear. So we have done actually that. So basically, yeah, by the word, okay, acromioclavicular means you want to, so this is clavicle bone and this is scapula bone. So here the articulation is called acromioclavicular between the clavicle and acromion process. Intercarpal, carpal means the bones of the hand here, so we have got 8 carpals. Intertarsal means in the foot, so intercarpal means in the hand, intertarsal means in the foot. Zygapophyseal I have already shown you. Costotransverse and costovertebral is in the transverse process and the body of vertebrae. Superior tibiofibular articulation means at the superior aspect of tibia and fibula. Is it okay, Ritika? Okay. By the name, you can connected. Okay, because in our body, if we go for the plain joint, I have given you the most important. There will be several in one joint only. I have to give you 20 images more. So most important one you have to see and you have to write. Okay, this is always asked, these kind of examples, and you have to by heart it. It's very easy. There is not exactly the whole one movement in uniaxial plane, because it's just the bone has got slight gliding movement. So it's not like full flexion extension occurs. It's just the bones are gliding over one another. The bones are slightly gliding over one another. Okay, dear. Now hinge joint. Hinge joint. If I talk about hinge joint is basically having the movements and like morely the flexion and extension movements. So basically examples. So I think in the table is also there. Can anybody tell me? Elbow joint is an example of hinge joint. Ankle joint is an example of hinge joint. Proximal and distal interphalangeal joint. Interphalangeal joint. Again, this is an example of hinge joint. Now, if you will see, yes, pulley shaped and the movement occurs. So if you will see, this is my finger. So this is one phalanges, this is another, and this is the third. So you can see the joint in the finger also. You can see the joint which is between the proximal, middle, and the distal phalanx. So 1, 2, 3 phalanx are there. So there will be two interphalangeal joints. So in between the phalanx, the joint is interphalangeal. So we have got movement in one plane, flexion, extension. We have got the movement in the ankle, that is dorsiflexion and plantar flexion, elbow flexion and extension. So these are, yes, they act as like a hinge. Have you seen the door opening? Have you seen the door? Everyone must have room doors. So they are opening in one direction. So that hinge, so it appears like a hinge. So such kind of joint in our body example will be elbow and ankle. So I think everybody is knowing what is ankle and what is elbow. No doubt about that. Just write on the example. Okay. Now, pivot joint. So when I'm talking about the pivot joint, here's rotation happens. So there is a vertical axis. So exactly, can anybody tell me which bone is this? This is the radius bone. So this is the radius bone and this is the ulna bone. Okay. So this is the radius and ulna. Aditi Pandey, TM joint. No, we will separately study TM joint. It is not just plain hinge joint. It is a complex. It's a complex joint, and I will tell you because it is again atypical. Aditi, TM joint one lecture will be there, so don't worry. It is an atypical. So I am writing the typical one. Whichever is having atypical features, I am not mentioning it. Otherwise, you will get confused. Okay. So structurally, if you will see, the condyles are articulating. So it can be a complex condylar joint. So radius and ulna articulation. So when I am talking about the articulation which is between the radius and ulna, it's a rotation. See here, this is supination. And what is this? This is pronation. Supination, pronation. So what I am doing in the forearm, this is rotation. So supination and pronation is occurring. So pivot joint is helping in the rotational movement. So we have got the example as the superior radioulnar joint, inferior radioulnar joint. Yes, atlantoaxial also. I will show you that. Okay, please write down. Write down the examples. The examples are superior and inferior radioulnar joint, superior and inferior radioulnar joint. And one more example is, yes, dear, atlantoaxial, Priya, you are right. But best answer will be not just atlantoaxial. Best answer will be median atlantoaxial. What is the best word? Median atlant. Because lateral articulation is again plane type. If I am talking about the lateral articulation between atlantoaxial, that means first cervical vertebra and the second cervical vertebra, is again plane type. So I will write the better word, that is median atlantoaxial joint. Yes, diarthral, wherever. Yes, dear, diarthral. Uh, Arshi, diarthral means the movement, wherever movement is there. That means all category of synovial joint which I am writing are example of diarthrosis. All example of fibrous joint is synarthrosis. Cartilaginous joint is amphiarthrosis. That I am already explained. Yes, median is the better word, because again, Anurag, if I am using the word lateral, that means it's a plane type. So lateral articulation between axis and atlas bone is plane type of synovial joint. If you want to add on in that example, you can add on. Now, condyloid joint, condylar joint. So here actually you can write this is structural classification. Structural classification. So if you will see why, I will tell you. For example, if I take the example of femoral condyles and tibial condyle articulation, it becomes condylar type. And here also you can see this is metacarpal bone. So this metacarpal bone is like a condyle. So safe, that means this example is according to the structural classification. So according to, that means according to this condyloid joint will be an example of metacarpophalangeal joint. And the other one is metatarso-phalangeal joint. Actually, I will also tell you, but I will explain one very important concept here, because metatarso-phalangeal and metacarpophalangeal joint is an example of ellipsoid joint, because the movement is occurring in more than one plane. So they are biaxial joint. So if option is there that metatarso-phalangeal joint and metacarpophalangeal joint is an example of condyloid joint or ellipsoid joint, then you have to mark the correct answer as ellipsoid joint. Yes, yes, Anurag. Condylar articulation is also seen in TM joint and knee joint. Condylar articulation is seen in TM joint, that is temporomandibular, TM joint and knee joint. So why I am written seen? Why? Because overall, for example, overall, if I am talking about knee joint, it is a modified hinge joint. So for example, if I am talking about knee joint, it is a modified hinge joint. TM joint is actually bicondylar articulation, and it is also having atypical features, and it is a complex joint because it is having articular disc inside. So that means if I'm just taking the condylar part, then it is a condylar type of articulation. But overall, they are not just plain hinge joint or plain condylar joint. Functionally, they will be a separate. So don't worry about TM joint, because TM joint is already a separate class for you, and no one is going to ask you about the details of knee joint in the dental part. Okay, I will explain. So yes, Nandita, can you see this figure, everyone? Can you see this image? So can you see the articulating surfaces? Can you see this articulating surfaces? So it appears like condyles, no? It appears like two condyles are articulating. It appears like two condyles are articulating. So according to the shape, it is called as condylar articulation. According to the structure of articulating surface, we can categorize as condyloid. But when we go to the functional aspect, when we go to the functional aspect of any joint, for example, wrist joint, flexion, extension, slight adduction, abduction. So you can see wrist joint, flexion, extension, slight adduction, abduction. So you can see movement. If we take an example of functional aspect of that joint, then that becomes ellipsoid. But if we see the shape of the joint, we consider the shape of bones forming the joint, then we will call it condyloid joint. Got it? Got it, Tanvi, Nandita? Means when we are giving priority to the shape of joint, then it is condyloid. When we are giving priority to the functional aspect of joint, then it has got a different category. So don't worry, there is one or two joint only. For example, here metacarpophalangeal joint, metatarsophalangeal joint, an example of condyloid joint, condylar articulation. But metatarsophalangeal joint will be ellipsoid joint according to its functional aspect. Okay? No. So actually, no, they use it they interchangeably use it, but no, that is not correct. No, Nandita, that is not correct, because a few years back in the NEET PG also the question came, not in the dental part, in the NICT part, in the NEET PG MBBS PG wala. So in that also one time one question was asked where we have to mark the most correct. So we will mark ellipsoid joint as the most correct. For example, take an example of like human beings. How we look by seeing each other, that is one feature, but what is important is not the look. What is the important is the functional ability of ours. Okay, so that is which is giving more importance to that joint. Function. Now Mittal, always function, always function, always function, always function. I already told you, always go for function, go for ellipsoid joint. Now we have not entered in the ellipsoid joint, my dear. I'm coming to that. So such kind of question will be not asked confusing one, but if it is asked, what I told you, go for ellipsoid joint in these two varieties. Okay, ellipsoid joint. Ellipsoid examples are, write down, wrist joint, wrist joint, so actually for this articulation, actually ellipsoid and condyloid interchangeably it is used, but if we give more importance to the functional ability, we will write ellipsoid as a better one. So it is interchangeably used because of the shape. Okay, it's a joint where there is ovoid or egg shaped articulating surface. So basically it's a biaxial joint. So it's a movement is occurring in like a movement is biaxial. So their movement is occurring in two planes. For example, flexion, extension, also abduction and adduction. Okay, so I'm giving more importance to the functional ability. So ellipsoid. Interchangeably, they tell that condyline and ellipsoid is same, but I personally feel that we should give more importance to the functional ability. So yes, then we have got the category example wrist joint, which is also called as radiocarpal joint. I also want you to know this name, radiocarpal joint. The reason is that why wrist joint is called as radiocarpal joint, because the formation of wrist joint, it feels like students sometimes get confused that this is the radius bone laterally and medial bone is ulna, and these are the carpal bones. So the articulation must be happening between the lower end of radius and ulna and the carpal. So but not, that is not the case. Actually the articulation is only happening between the radius bone and the carpal bone. Yes, dear. Atlanto-occipital. Absolutely a thumbs up goes for Anurag. Very good, dear. Yes, a thumbs up goes for you. Very good. Yes. The articulation between the first cervical vertebra and this occipital bone. Posteriorly, this is the occipital bone. That example is also ellipsoid. So, other example are metacarpophalangeal joint. I have written in short. Metatarsophalangeal joint and atlanto-occipital joint. Okay, so the shape of articulation is like a ellipsoid shape, and the movement is occurring in two planes, both flexion extension movement in one plane, another plane abduction adduction. My dear students, are you understanding? Please let me know. Give me a thumbs up if you are understanding. Please write on the examples. Understanding, students? Okay. Done? So if you are understanding, so you can give me a thumbs up for it. Okay, very good. Very good. Okay, thank you, dear. Thank you. Now coming to the thank you, Anurag. Thank you. Now coming to the polyaxial joint. So when I'm talking about polyaxial, so till now what was some joint was moving in one plane, some joint was just gliding, sliding, nothing else. Some joint was moving in two planes. There is a third category of synovial joint. There is the movement in three planes. So a best example of that is hip joint and shoulder joint. So shoulder joint also flexion is there, extension is there, adduction, abduction, medial and lateral rotation. So actually we have got two best example of multi-axial joint. One is the hip joint where the articulation is between the longest bone of our body, femur, and the hip bone. And another one is the shoulder joint where the articulation is between the head of humerus and the shoulder cavity, that is glenoid cavity. So the movement is occurring in more than two planes, that is three planes. Okay. So yes, Nikhil, if you want to see, then I have to stand up. Okay. If you want to see, I have to stand up. Yes, Nikhil. So see here. See, students, see here. This is flexion. This is flexion. I can't come. This is flexion. This is extension. This is abduction, moving away from the body, and this coming back towards the body is adduction. So this is movement away from the body is abduction and coming towards the body is adduction. This is medial rotation and this is lateral rotation. So that means in the shoulder joint, we have got a multi-axial movement. So the movement is occurring in more than two planes. So it is a multi-axial polyaxial joint. Okay. So the example is hip joint. Examples. So the examples are hip joint. Yes, I will write all. In the ear ossicles also we have got. That is the joint between incus and stapes. Yes, incus and stapes. And also one in the foot, that is talocalcaneo-navicular joint. Very goodly. Hip joint, shoulder joint, incudostapedial joint. Incudostapedial joint. And we have got talocalcaneo-navicular joint. Talocalcaneo-navicular joint in the foot. So actually, in the case of articulation, the articulation between the head of femur and that of acetabular cavity is an example of this hip joint, and the articulation between the head of humerus and the glenoid fossa is shoulder joint. The articulation which is between the incus and stapes. Incus, stapes are the, so stapes is the smallest bone of our body, and we have got three ear ossicles. So we have got malleus, incus, and stapes. So the articulation between malleus and the incus is saddle type articulation, but the articulation between incus and stapes is ball and socket type of synovial joint. Talocalcaneo-navicular is the articulation between three tarsal bones. That means three bones of the foot: talus, calcaneum, and navicular. So the articulation between talus bone, calcaneum bone, and the navicular is again. Okay. So that is very important. Talocalcaneo-navicular joint. Okay. Yes, Anurag, you can just Like synovial variety TM joint, posteriorly there will be articulation between the articulation between the ellipsoid occipital bone and the atlas bone. That is also a synovial variety. Okay, now coming to the saddle one. So have you seen the horse riders? Have you seen the horse riders? So they sit on the saddle. So the shape is somewhat like this. Can you see? This is the shape of the saddle on which the horse riders sit and ride the horses. So in the saddle also we will have more than two planes of the movement, and the best examples are, so write in the example, first carpo metacarpal joint. First carpo metacarpal joint. Actually, only the first carpo metacarpal joint. This is thumb. That means which joint? Thumb joint. So only the first carpo metacarpal joint is saddle variety. Rest all carpo metacarpal joint is plain type. So if I am talking about all other carpal and metacarpal articulation, carpal and metacarpal. So these are carpal bones. Okay, and these are metacarpal. So articulation between first is saddle variety, rest all is plain type of synovial joint. Other examples are calcaneo-cuboid joint. So when I am talking about calcaneo-cuboid joint, the articulation between the heel bone, calcaneum bone, and that of the cuboid tarsal bone. The articulation which is taking place between the heel bone and that of the cuboid tarsal bone is again example of saddle variety of synovial joint. Sternoclavicular joint. So by the name only it is clear, sternoclavicular joint. The articulation between the sternum and the clavicle is called a sternoclavicular joint. Again an example of saddle articulation. One more example is in the ear ossicles, and my dear students are knowing it. I have already told you. What is that? Articulation between incus and malleus. So inguido-malleolar joint. Malleolar joint. So this is an example of saddle articulation. Okay, dear. So we can go with the explanation. So please finish it. So okay, after this we will solve few previous year MCQs. After this we will solve few previous year MCQ. Are you ready, everyone? After this topic I want to explain, or I just want to check whether the students have understood or not, and few of the previous year MCQs, can we solve it correctly or not? Is it okay? Can we go for it? Everyone is ready for it? Let me know. Okay. Okay. Synovial joint here. Yes. Who asked this? Cricothyroid. Synovial joint here. Who is this? Anurag. It is a synovial joint. Okay. Synovial joint. So let's move. Yes. Everyone. The joint between. All of you are ready? Please mark the right answers. So the joint between epiphysis and diaphysis is an example of suture, symphysis, synostosis, or synchondrosis. Okay, the joint which is formed between epiphysis and diaphysis is an example of synostosis, symphysis, sutures, or synchondrosis. Okay, I'm just checking my mobile for your answers, and my dear students are telling it's an example of synchondrosis. And absolutely a thumbs up goes for you. Can you tell me what is the other name of synchondrosis? Synchondrosis is also termed as. My next question is, what is the other name of synchondrosis? Absolutely correct here. Thumbs up goes for everybody. And I'm so happy. Okay. Yes, everyone is right. Synchondrosis is also called as, yes dear, synchondrosis is also called as which type of joint? Primary cartilaginous joint. Primary cartilaginous joint. Now, radio-ulnar joint is which type of joint? Yes, again, yes, dear Ravi Chandran, absolutely right. Namrita, Harshita, Saurabh, everybody is right. Yes, absolutely correct. Yes, now the next is radio-ulnar joint is an example of which type of joint? Radio-ulnar joint. Radio-ulnar joint. Question number second. Radio-ulnar joint is an example of pivot, hinge, ball and socket or fibrous. Everyone is just, no dear, no. Radio-ulnar joint, no. Yes, I got right answer from Saurabh. Saurabh is absolutely right. Saurabh is absolutely right. Saurabh, you are absolutely right. Yes, pivot is right. Why? Because the question has asked about radio-ulnar joint. So that means mainly the articulation is, there is two radio-ulnar, no, superior and inferior radio-ulnar joint. There is superior and inferior radio-ulnar joint. So superior and inferior radio-ulnar joint is pivot. And if you talk it specifically, the question is asked middle radio-ulnar joint. If the question is asking middle radio-ulnar joint, then it will be a type of fibrous joint, that is syndesmosis. Then it will be a fibrous joint. And the fibrous joint, which variety? Syndesmosis. Which variety? Syndesmosis. Got it? So if it has just written radio-ulnar articulation, then the answer is pivot. Everyone okay? So I think most of you are knowing the answer, but you have just followed what you have seen D, then everybody D. Okay. The question is not asking about middle radio-ulnar joint. It is asking about radio-ulnar articulation. And we have got superior and also the inferior radio-ulnar joint as the pivot joint. So A will be the right answer. Okay. Can we move to the next MCQ? Diarthroidal joint is a type of Diarthroidal joint is a type of synovial joint, fibrous joint, amphiarthrosis or synchondrosis. Diarthroidal joint. Let me see who are getting me right answers. So again, everybody is now giving a right answer. So now I can give you a thumbs up. Yes, now it is right. Yes, dear. So the right answer is synovial joint. So synovial joint, highly mobile, diarthroidal joint. All these joints, all these questions are from previous year INI, CT and NEET PG. NEET MDS PG. So this I have not explained, so I will not ask. Now this is an image-based question. This is an image-based question. So now the image is asking about the arrow marked area. So firstly, identify the arrow marked area and now tell me the right answer. Identify the joint type. So firstly, you have to identify the arrow marked area and then tell me which type of joint is it. Okay, question number 4, I didn't call you because cartilage I have not explained. Cartilage topic is remaining, so I have directly come to this. Okay, now you have marked it right. Now, one question you have marked wrong previously. Now you have got 100% right. Very good. Yes, the connecting structure is intraosseous membrane and ligament. So the right answer is syndesmosis. Very good. A thumbs up goes for you. Very good, dear. Syndesmosis is the right answer. Absolutely correct. Syndesmosis is the right answer. Got it? Okay. Yes, you are absolutely right. Now we will move on to the next topic for today's session, that is cartilage. So do you want, so I think you can have a break now because next topic will be the cartilage. So I think you should, I will give you a break now and then we can start. Because next topic I want to start, but it will take another half an hour. So I think you, I will give you a break and then we can continue in the app. Okay. Okay. Okay, so basically, Himani ma'am will come. I think no break, no, please wait. I think Himani ma'am will join and then we will start again the session. So I think Himani ma'am will join. So yes, let's. Okay, okay, ma'am will join and then we can connect in the app. So because I we will diarthrodial joint. I think you have missed the first part where the joint is moving in multi the synovial joint, those kind of joint which can have a highly mobile joint. So synovial joint is having synovial membrane and the secretion of synovial fluid. So they are they can move. So they are called as mobile joint and these becomes an example of diarthrodial joint. Okay, it's a movable joint. Yes, dear. Okay, so should I stop now? Okay. Okay.